Post-traumatic stress disorder in Shutter Island, Charlie Kobdish. Background and diagnosis. Shutter Island focuses on a man named Andrew Latis who has been imprisoned in a hospital for the criminally insane after shooting and killing his wife after she drowned his three children. Andrew fights to come to terms with the reality of his trauma by adopting a false persona that he is a United States Marshal investigating the prison in which he is actually a patient in. The film's culture is revolves around US culture in 1954 when the film is set, and it portrays the psychiatrists on the island as capable and more than patient with Andrew as he fights to come to reality. I would diagnose Andrew with post-traumatic stress disorder because of a few evident symptoms that show a persistent and harmful stress as a result of his specific traumatic incidents. Cultural cues. Andrew's diagnosis in 1954 would likely be gross stress reaction, the DSM's precursor to PTSD, which would come about 3 decades later. Generally, I believe that PTSD is diagnosed consistently throughout the world's cultures. However, its symptoms may manifest differently. Stigmas surrounding PTSD usually consist of a failure to empathize with those who suffer from the disorder, who say that they need to just get over their stress or their trauma and do not empathize with the sufferer. Evidence of PTSD. His first easily identifiable symptom is recurring flashbacks of his time fighting in World War II and fighting in a concentration camp and seeing the horrors surrounding that. His second easily identifiable symptom is avoidance of distressing memories with regards to his three children and his wife. He loses all touch with reality and completely forgets the incident. One symptom that he does not portray is markedly diminished interest or participation in significant activities. By adopting this persona of Teddy Daniels, he actually becomes just as motivated as anybody could be to achieve his false investigation. Interestingly, this symptom was included in the first DSM's publication for gross stress reaction, and the psychiatrists on the island would likely have mentioned that he meets all of these symptoms except for diminished interest in significant activities. I propose essentially the same treatment that the psychiatrists on the island attempted. That is to allow Andrew as much time comfortably in his false persona to come to terms with reality on his own, rather than having it shoved in his face, to expose him slowly to the reality of the situation. The main ethical concern with that is that throughout the movie we learn that Andrew has a history of violence towards those in the hospital and those running the hospital. That may be too much of a risk. The cultural barriers blocking this treatment likely would involve the stigmas surrounding PTSD. People may not have the patience to play along with Andrew's little game. They may not see the value in treating him, especially if he has those violent tendencies. And I would also note that his delusions and adoption of another personality are a healthy coping mechanism, not necessarily something to try and push back against. They will probably aid in his getting better, if that's at all possible. Broader perspectives. I do believe that this is a great portrayal of the symptoms of PTSD. Throughout the movie, you can notice essentially each of the components. Now, there are likely other psychological disorders that he would be diagnosed with in addition to these, but he definitely has post-traumatic stress disorder. And I do believe that trauma as severe as his would be diagnosed in other cultures. However, since he did murder his wife, I believe that other cultures, and likely the United States culture as well, would have a lot less empathy with that trauma.